Do you want to start with a Ghanaian proverb?
Well, it goes like this. If the fish in the river forgets the trap will not forget the fish.
Can I translate? You explained this to me earlier today. Even in places of healing, the threat doesn't disappear just because we're focused on care. Am I right?
Perfect, you did well. Here's a terrifying statistic. In 2022, over 75% of healthcare organizations worldwide faced ransomware attacks, with hackers literally holding patient lives hostage. And today, we're diving into how this exact scenario is playing out across Canada's hospitals right now.
That's actually a perfect segue into what's becoming one of the biggest threats to modern healthcare. We're not just talking about stolen data anymore. We're talking about life support systems being compromised.
You know what really keeps hospital administrators up at night? The fact that everything from IV pumps to pacemakers is now connected to the internet. It's like having thousands of digital doors that need constant monitoring, and some of these doors are practically being held together with digital duct tape. Would you believe that many hospitals are still using decades-old software while trying to fight off AI-powered cyber attacks?
That's like bringing a butter knife to a gunfight. But here's what's really concerning. Let's talk about what happened at Toronto's Hospital for Sick Children recently.
That ransomware attack was devastating. Their lab and imaging systems were completely compromised, delaying critical services for some of our most vulnerable patients. And that wasn't even an isolated incident. In Newfoundland, Eastern Health had what? Over 200,000 patient records exposed? That's basically the population of Regina having their most private medical information compromised. Well, here's what makes this particularly frightening. Those records contain everything from social security numbers to detailed medical histories. Information that, unlike a credit card number, can't just be changed if it's stolen.
You know, I've been thinking about the real human impact of these attacks. We're talking about cancer patients waiting for test results, elderly people who can't access their prescription information, nurses locked out of vital patient records during their shifts. That raises an important question. Why are healthcare systems so vulnerable in the first place?
So here's the perfect storm that makes healthcare such an attractive target. First, you've got outdated systems that can't easily be updated. Then there's the staff situation. Medical professionals who are already overworked being asked to become cybersecurity experts overnight. And let's not forget the budget constraints. When you're choosing between new medical equipment or better firewalls, that's not an easy decision.
But here's something encouraging. Some Canadian healthcare institutions are actually leading the way in fighting back. Take eHealth Ontario and CISHI. They're pioneering new approaches to encrypted digital health records that could set standards for the whole country.
That's right. And Unity Health Toronto has developed this comprehensive cybersecurity awareness program that's actually changing how healthcare workers think about digital security.
You know what fascinates me about this whole situation? We're dealing with this constant tension between accessibility and security. Everyone wants their medical information at their fingertips, but they also want it completely protected.
It's like trying to build a house with completely transparent walls that are also completely secure. Those two goals are naturally in conflict.
And here's where it gets really interesting. Some experts are saying that by 2025, healthcare will be the most targeted sector for cyber attacks globally. That's huge, considering we're talking about a $254 billion industry in Canada alone.
Well, that brings us to the practical side. What can people actually do to protect themselves?
So can you break this down into some actionable steps?
First, never access health portals on public Wi-Fi. Second, always log out of shared computers. And third, this is crucial, ask your healthcare providers about their data protection policies. And for healthcare workers, it's even more critical. Using password managers, enabling multi-factor authentication, avoiding personal emails for work. These might seem basic, but they're crucial first lines of defense.
You know what really stands out after this conversation? This isn't just about protecting data, it's about protecting human dignity. When someone's health information is compromised, it's not just a security breach, it's a violation of their fundamental rights.
That's exactly right. We're talking about people's lives, their privacy, their trust in the healthcare system, and once that trust is broken, it's incredibly hard to rebuild.
Looking ahead, I think we're going to see some major changes in how healthcare handles cybersecurity. The threats are evolving, but so are the solutions. And that's actually giving me hope for the future.
Well, that's a perfect way to wrap this up. Remember, everyone, protecting healthcare data isn't just about security, it's about preserving the very foundation of modern medicine.